My name is David Feinerman. I'm a dual degree oral and maxillofacial surgeon, a dental degree from Harvard, medical degree from the University of Connecticut. I've practiced in Florida for the last 17 years. We have a full scope oral and maxillofacial surgery practice with a heavy emphasis on dental implant surgery. Before coming to Florida, I was a clinical instructor at the University of Connecticut, and I'm a part-time clinical instructor now at Nova Southeastern University Dental School. We like to have a practice that we consider high-end, and so when we looked for an implant company to join us, it was very easy to team up with Straumann. They're the _1 implant company in the world. They have, if not the largest, one of the largest sales forces of all the implant companies. We get great sales support from our territory managers. We get great technical support from the people in Andover. And maybe even more than that, they are constantly bringing new technologies to us that really set us apart from other practices using different implant systems. We're branded as leaders in our community in the field of dental implants, and a lot of that has to do with our teaming up with Straumann. When people are trusting us to take care of them, they want us to choose something that has a lot of science behind it, a lot of clinical studies, a product that has withstood the test of time. And that's why we choose to put Straumann Components in our patients. We're confident that they have decades of research behind them, plus we have good clinical success ourselves. So as an implant surgeon, it's very important to us that we pick a product that we have confidence in and that we trust, and that's why we use Straumann implants. Once we place our Straumann implants, we ask our dentists or even insist that they use Straumann Components on our Straumann implants, because the studies show that if they use non-Straumann components that are compatible, that's not the same thing as authentic. It could lead to things like screw loosening, micro gaps, micro movement, bone loss, peri-implantitis, and even loss of implants. Patients put a lot of trust in us to be their surgeon. It's really a privilege to get to operate on people. And when they put that trust in us, we had to look for an implant company that we trust, and that company happens to be Straumann. So we go ahead, choose Straumann as our implant of choice, and then almost insist that our referring doctors use Straumann Components on the Straumann implants. There are many studies out there to show if they would use compatible components that are not authentic, it could lead to problems such as screw loosening, micro movement, micro gaps, bacterial contamination, which could ultimately lead to bone loss, abutment failure, or implant failure. It's great as an implant surgeon who uses Straumann to be able to look a patient in the eye and say, we're using a product that has a lifetime guarantee on it. It enables me to differentiate myself, I think, from some of my competitive surgeons, because in our practice, we tell the patient, if anything goes wrong with your implant in the first 5 years, we'll replace it at no charge. And it's so infrequent that we have a failure using the Straumann products that we can say this with a lot of confidence. And it really goes a long way for the patient knowing that their implants warranted for a lifetime and that we're going to replace it at no charge if something happened in the first 5 years. We also stress to our referring doctors that this lifetime warranty means they will have to use a Straumann component on the Straumann implant, original on original. I think the studies speak for themselves that they should do that anyway, but certainly to take care of our patients, we need them to have a warranty that lasts a lifetime. We need them to use original on original components. You're only as strong as the weakest link in the process. And so if Dr. Shadle, my partner, and myself choose Straumann as our implant of choice, but then send the patient to a referring doctor who uses a lab that uses imitation components, copycat components, it really doesn't matter that we use the Straumann implant, or it could actually cause some problems in the future. So we stress to our referring doctors that they should find a Straumann lab that uses Straumann components. It'll prevent all sorts of future complications, because the most expensive implant, as you know, is the implant that fails. So we ask them not to save a couple of dollars in the short term, which will cost them much more in the long term. Straumann did a great study not too long ago where they put a Straumann abutment on a Straumann implant and some copycat abutments that said they were compatible with Straumann. And then they did the typical test that you do on these abutments and implants. It's the cyclical load test, where a weight comes down literally millions of times on that implant abutment connection. Then after the million of cycles, they studied the implants and the abutments. The Straumann abutments performed the best, not surprising, but the other abutments showed screw loosening, screw fracture, as well as the implant loosening from the bone model that it was in. So we have scientific evidence that the Straumann components on Straumann implants do better under cyclical loading. It's not surprising if you ever look at a cross-section of the way the Straumann cross-fit connection fits in the implant versus the copycats. There's so much more buttressing and so much more contact with a true cross-fit connection within the Straumann implant than the copycats. When we work with referring doctors and labs, we always stress to the doctors we want them to use a lab that is a Straumann lab or a CARES lab. There has to be a lot of trust amongst the three principals, the surgeon, the referring doctor, and the lab. We don't want non-Straumann components going on our implants. It could lead to bone loss, peri-implantitis, abutment fracture, and also implant loss. So we support all the local Straumann labs in the area, and we try as best we can to get our referring doctors to use one of those labs. Straumann recently decided to put their laser markings on their abutment. So they have their logo and a lot number on the abutment, one way to tell that it's a Straumann product. Some other ways are the lab or the surgeon can send stickers on their letters that says it's an original Straumann component, and there's some online feature that I haven't used myself where you can also tell that it's an original Straumann component. The other nice thing is that if you put a Straumann abutment with a cross-fit connection on a Straumann implant, you can feel how it falls in. You just rotate it a little bit, it falls right in. And the other nice feature is you'll never be able to tighten the screw unless that abutment is seated properly. So it's almost like you don't have to take an radiograph. You feel the abutment fall in and you tighten the screw, and that implant's in position. If you don't have the abutment in the right position, the screw cannot be tightened. So placing an implant requires a team concept. And we have a shared responsibility approach where the surgeon is responsible for the surgical aspects and the restorative doctor obviously responsible for the restoration in conjunction with the lab. And we'd only be as strong as our weakest link. If we have a restorative doctor or a lab that's not putting original Straumann components on our implants, it could lead to problems down the road, such as abutment fracture, screw loosening, micro movement, micro gaps, bacterial contamination, bone loss, peri-implantitis, etc. So we try to surround ourselves with people who understand these concepts. We talk about it at our study club meetings. We have our doctors interact with the Straumann labs in the area, and it's just a message that we try to get across, that we need to all be on the same page. Not only is it important for us, but it's so important for the patient in the long term. One of the nice things about using Straumann components on Straumann implants is that it's extremely, extremely rare to get screw breakage. And occasionally, we have our doctors not use Straumann components and something will break. And if you've ever tried to get a broken abutment screw out of an implant, it is sometimes easy, but many times extremely difficult and time-consuming. It's not the most pleasant experience for the patient because they have to sit for a relatively long period of time with their mouth open, where you're trying to very delicately get that broken screw out without damaging the walls of the implant. Occasionally, it's even been necessary to order a special screw removal kit from Straumann that actually centers the surgeon to drill out the broken non-Straumann component from within the implant. Again, it costs time. The patient is very distraught during this process, and it's one of the least favorite procedures we do in our office. There's some great studies that have been done by Straumann where they connected non-Straumann components to their implants, the so-called copycats or lookalikes that are compatible with Straumann. And so they put these non-Straumann components on the implants, and the typical test you do is something called a cyclical load test, where you have a weight that comes down and just bangs on the implant abutment system literally millions of times. And after they do that, they looked at the implants that had a Straumann component on a Straumann implant and the non-Straumann components. And they showed there was more screw breakage, more screw loosening, more implant loosening within the bone model that they had if you had a non-Straumann component. And it's simply put, the buttressing and the stresses of a copycat abutment are not the same as a Straumann component. We're only as strong as the weakest link in the system. And so if my partner, Dr. Shadle, and myself are choosing Straumann as our implant of choice, and then the restorative doctor chooses a lab who's using some sort of imitation component, it really negates the fact that we chose this implant that has years of research behind it and years of clinical success. So we try to find a lab that we know is going to use Straumann on Straumann components. We introduce this lab to our referring doctors. We suggest to our referring doctors that they use a Straumann lab. And we also try to stress to them that the lifetime warranty of the implant and the abutment will be voided if they use a non-Straumann component. It's really easy to identify if something is Straumann. On the abutments now, Straumann laser etches their logo onto the abutment along with the lot number, so you could simply look at it. There are also stickers that I could send to the referring doctor, or the lab can send to the referring doctor, that says this is an authentic Straumann component as well. If you can't see the logo, you can't see the lot number, you can almost always feel, if you're using a Straumann CrossFit abutment, the way it falls into the implant. And one of the nicest things is that the screw will not engage until that CrossFit connection is in the correct way. So it's a really great feature of using a Straumann component. You don't even need an x-ray to know that your abutment is down, because it falls in and you can engage the screw. And you won't be able to engage that screw unless the abutment's in the right position.